Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to talk all about risk factors for mental health concerns and, as clinicians, the various places we could intervene. What will be interesting to note is that this video is a springboard for a couple more videos that will follow, in which we'll go into a deeper dive. But without further ado, let's get into it. So if you were to ask, what are some risk factors for mental health concerns? They really come in different ways. The first area that we're going to talk about are biological influences. And when we talk about biology, we're going to talk about the brain, we're going to talk about neurotransmitters, we're going to talk about hormones, we'll talk about chromosomal and genetic conditions. We also have to be mindful of emotional influences. So we will talk about things like temperament, emotion regulation, and so forth. And then we'll talk a little bit about behavioral and cognitive influences. Behavioral factors are what you do. So if you're trying to understand a child's functioning, you might want to pay attention to their actions. And if you were an applied behavioral analyst, you would set up a behavioral plan to increase the desired behaviors and get rid of undesirable behaviors. But we also have cognitive influences. Cognitive influence is how we think. So people who have a more pessimistic outlook are going to be more prone to mental health concerns. Finally, we have to understand sociocultural factors. These are family-based factors and some of the stressors within the family. We also have to be mindful of cultural variations and the pressures of being part of an in-group versus an out-group. And last but not least, we have to understand ethnic variations as well. So if we were to try and understand what is driving mental health concerns, all of the above. And each of these factors impact and interact with one another. So your biology can alter emotional influences, behavioral, cognitive, and sociocultural factors just as much as your cognition can impact all of the above. So it's almost like a spider web of interacting forces. So these are our risk factors. But we also have to ask ourselves, okay, now you're the clinician, you know all the risk factors. Where do you intervene? What are you going to focus on first? The general principle is that you would focus on the most distressing factors first, particularly anything that comes with risk of self-harm or harm to others. That's going to get targeted first. Now, but as a byproduct of the previous slide, you can have family-based concerns. So let's say we take this kid, Jorge, and Jorge was diagnosed with ADHD, and Jorge was misbehaving in the classroom, misbehaving at home. It is possible that the parents could become more frustrated with Jorge, and we might need to consider a family therapy model to work with the family to figure out strategies to best help Jorge. We also have ADHD. It could impact one's academic performance. So Jorge might be making careless mistakes in the classroom. Jorge might be impulsive, and as a result, it's possible that he's receiving increased criticism or social alienation from his peers. And that might lead to things like anxiety or worry that he's either not good enough or he's going to fail. So anxiety-based conditions and poor self-concept can occur. We also have biological factors. It's possible that the prefrontal cortex is not working properly for Jorge. And then there might be some cultural stress factors that we have to pay attention to. So, where do we intervene? The answer is we intervene in all of these places, but we're going to target the one that's most distressing. So, if the poor academic performance is causing anxiety and worry or poor self-concept, we might target that first because that's going to cause significant psychological distress. We might also consider a social skills program to reduce the criticism at school and teach Jorge how to interact better with his peers. And these are just examples of risk factors and where we might target. And I love this slide because it isn't just one area that we have to consider. We have to target all areas wherever possible. So for a biological influence, we might consider a pharmacotherapy, something like Ritalin, Adderall, or Strattera, which could help Jorge perform better in the classroom, help Jorge filter out what's important versus what the distractions are, and so forth. So that is the lecture that I want to start with, but we're going to move into theoretical foundations and developmental considerations next, and then we'll go through all of the various domains. But that's our first video in this series. I hope you found it useful. If it was meaningful, please hit the like button on the video. Consider subscribing to my channel. That will allow you to know when I release a new video. You'll have access to all of my content, and the notification bell will send you an alert as well. Additionally, if you have any questions or any thoughts about today's video, feel free to put it in the chat. I love your feedback. I love the questions that you ask. They're all meaningful to me, and I read and respond to them all. Once again, I hope you found this useful. Take care, everybody.